Hi, my name is Erica Metsu, and welcome to my presentation on Itriage mobile app. Well, if you ever had an emergency where you had to seek a medical attention, you may have went to the ER and been faced with long wait periods up to 2 to 4 hours. Well, I'm excited to discuss a new app called Itriage. It's a mobile app, and it's been launched in order to help alleviate long wait times in the ER. When looking at solving the problems for long ER waits, the app hopes to accomplish this by actually decreasing the number of visits to the ER, therefore decreasing the number of mortalities and also improving healthcare delivery by decreasing healthcare costs and also allowing patients to have access to confidential files and records. Background of the problem. We'll discuss the significance of the problem, background, literature review, and ineffective changes that has been attempted in the past. A baseline analysis was conducted between January 2015 and May 2016, involving 32,000 patients who visit the ED. The study highlighted possible operational constraints as well as areas of improvement. The significance of the study illustrated that there was an increase to the attendance of the ER due to aging population, disease complexity, shortage in staff, and infrastructure limitations. The literature review reveals 6 themes surrounding why most people visit the ER. Number 1, perceived urgency. 2, anxiety. 3, the value that individuals place on reassurance. 4, views of family members and friends. 5, accessibility to healthcare and professional staff. And 6, individuals' ability to pay for costs such as copayments. Other interventions have been attempted to combat this problem, such as the team-based model of caring using a common board detailing work output, matching manpower to patient arrival. But due to the lack of standardized consultation between junior doctors and supervising doctors regarding patient management, wait times can sometimes be increased up to 2 hours. Innovative collaboration. I spoke with a nurse manager, an IT personnel, and a patient who had recently visited the ER. The nurse manager believed that the app would mostly benefit providers in coming up with different differential diagnosis. IT believe that it could be a cost effective app, would be useful for the end user, and the ER patient would be willing to try the app. Although there was some apprehension regarding the accuracy of the new technology, the overall consensus was that the app would be helpful to most users. The patient that I interviewed stated that she had waited over 2.5 hours to see the doctor and was DC with no prescription and was told to follow up with the primary. Utilization of this technology. iTriage has been utilized through Aetna. It's a user-friendly mobile app. It allows the patient to directly find out information on their own particular health conditions, giving them a step-by-step guidelines to treat the condition in the most effective way possible. The app gives them direction on whether their condition requires an ER visit, and if so, then there's turn-by-turn navigation to the most appropriate provider.
Itriage by Healthogen helps you make better healthcare decisions. Let us show you how. Suppose it is nearing the end of your workday and you begin having back pain. You open Itriage on your iPhone or Android mobile device and select Look up your symptoms. From this list of hundreds of symptoms, scroll down and select back pain. Itriage gives you a list of possible common causes. You can filter this list by selecting Show All, Pediatric, or Life-Threatening. Let's choose common. Here you see kidney infection as a possible cause. After reading the description, you decide that doesn't sound like what you are experiencing, and you go back to the list and choose herniated disc. After looking at the description and symptoms, you decide to learn more by reading about what tests may be done, the treatment you can expect, and even pictures or videos. Now you want to find someplace to be treated and select Find Medical Help near you. You can search by GPS or zip code. You choose zip code since you want a facility near your home. Itriage places green checks by the most appropriate facilities to treat the disease you are searching. You're also shown the physicians that specialize in this disorder. Selecting emergency department shows you a list of the ERs in your area. Some hospitals partner with Itriage to give patients more information, such as ER wait times, nurse advice lines, the specialty services the hospital provides, links to the hospital website, and even videos about the hospital. From this page, you can call the facility and even get a map and directions. If you wanted to find a doctor that specializes in treating a herniated disc, you can go back to the medical provider page and select neurosurgery, and quickly find the doctors in your area that treat this disorder. Download iTriage for your iPhone or Android smartphone. Also use iTriage on any web-enabled device at itriagehealth.com. Discover all that iTriage offers and never be without healthcare answers again.
Innovative solutions. The co-creators of Itriage were a group of ER doctors that helped develop the app. They wanted to address some very real issues that they saw in their everyday practice. And what they saw was that the consumers had an information gap when it came to choosing the appropriate level of care for a given symptom. So the hope of this app is to marry the symptomology with the diagnosis and come up with the best treatment plan for that diagnosis. The first question when using this app will be, is this an emergency? If the consumer answers yes, they will be prompted to call 911. If not, it continues on and provides a list of symptoms in alphabetical order, and the consumer will be able to click on possible causes. This in turn will give the consumer more information regarding the disease, including standard workups and treatments, which may prove to be very helpful in case of a clinical encounter. Workups and treatment guidelines are based on evidence-based practice, and there has been a review board that has been appointed to oversee the approved workups and treatment write-ups that have been found in the apps. One of the benefits of this app is that it comes at a low cost to the end user. It allows the consumer to have more control of their health care and the management of it, and it's fully HIPAA compliant. Well, thank you for giving your attention to this presentation. Thank you.